And then I'll share one final story with you, because I can talk numbers, I can talk policy, I can talk till the cows come home, but these faces, these are our stories. And each of you has a story as well. This is Joanne Cockey and her husband Tim Cockey, and this is a portrait of their son Luke. And this means a lot to me because they lost their son Luke in 2009. Luke was down Shockoe Bottom, hanging out with some friends, got into a fight, took a punch to the jaw, went down, hit his head, and he became an organ donor. That's simple. Just one fight, one punch, and it changes a family's life. And Joanne and her husband Tim have become huge advocates of UNOS. They've become volunteers. They will be on our Christmas parade float down Broad Street on the first Saturday in December. They're always the first folks that say, I want to ride the Christmas parade float for UNOS, and they will be there. But their son Luke was 23 years old, and he made that donation, and they made that commitment as a family. And in the end, I always bring it back to our donor families, because we can't make the match unless the person, the family, is willing to make that happen. And the Cockeys are a wonderful example of that, and there are many of them here across Central Virginia. I'm going to announce something today. Russell doesn't know this yet, but every year we do a class of Faces of Transplantation, and we introduce the new class. Usually there are 12 or 13 of them, and we introduce the new Faces of Transplantation during our fundraising event, United for UNOS, our soiree. We just had 2014 and unveiled the class. For 2015, Russell, you are going to be one of our Faces of Transplantation. And whether you like it or not. So what that means is you're committed for the first Friday in October to attend the soiree. And we're going to take a picture today, and I thought it would be so fitting that the organization that Russell has founded, that we take that picture today with all of you standing in the background. For those of you who would like to participate, I won't make you do it, but we want to take a picture of Russell and everyone.
I'm going to be in the picture.
You're going to be in the picture. You're first and foremost. They can, you can share them in the background. But this is what brings what we do to life, and these are the stories that you can share. This is what we're about. That is my presentation. And if you remember only one thing when you walk out that door today, remember that number one. We started this by talking about numbers, and one person can make a difference. That one donor, that one recipient that talks about the value of organ donation and transplantation. You can be that one person who can pass on all of the information that we've talked about today. So I thank you very much, and I know we've got a little bit of time if some questions are out there by chance, if I've done a spectacular job in covering all the information. And again, I do have some other brochures and information here. Oh, I should mention this too, and I will. We have a fabulous book. I've only got one of them here, but if you're so inclined, I can get your name and mail them to you. It's called What Every Patient Needs to Know. And this information is available online, but it's a wonderful book that really walks you through, as a transplant patient, some things that you need to be aware of. So if you're on the wait list right now, this is something that's really kind of crucial for you. Some great information. And then again, we've got brochures for each of the different organs, with liver, pancreas, kidney, and then multiple. Yes?
The LAS score, you said to get higher up on the list. The liver function test also would help put you higher on the list.
That liver function test is going to become a part of the LAS score. That's right. And when I say it puts you higher, so let's say that your score is 78, and there's somebody else whose score is 72, and you're both right here in Richmond, Virginia. The lungs from the deceased donor are here. Everything being equal, the person with the higher score, the 78, is going to go before the person who has a score of 72. Because that score shows that you have medical urgency, and it also shows through the questions and the information that's on that calculator that if the transplant happened today, that it would be a successful transplant. So, and that's just another piece of information that's going to add to the calculator. Yeah.
Lisa, two questions.
Go.
One, is there an age limit for receiving an organ, and is there an age limit for donating?
There are no age limits that we as an organization have people, that is written in policy. There are transplant centers that will put age limits on there, but there are none that are written into policy. So, and obviously, and particularly with lungs, when the donation comes in through a deceased donor, it comes into our computer system. It's called DonorNet, and very detailed information. And I can only tell you how it's changed over the years. But it's everything from the lung, what the lungs look like. They take pictures, and if there's any type of markings or discoloration or cyst or anything that would be on the lungs, very detailed of what they look like. And this comes through the doctors that are working on the lungs and doing the procurement, and then when the offer goes out to the transplant centers, and that offer would go out then to the person with the highest LAS score. So, yes?
Most educational for me. I want to start at the beginning. Several of my family members have told me that they are registered donors. I never took the discussion any further. I think you said you must die in a medical setting.
That is correct.
And you talked about tissue. And so is this matched after you're deceased? I see.
Yes,
Okay.
tissue is, and that's a great question. So when it comes to the life-saving organs, and think about it just take yourself back to that biology or science class when you were in high school, that once your heart stops beating and blood and oxygen stop being pumped into the organ, the death process starts, the deterioration starts, and you can't and you do not want to transplant a heart or lungs that start the decaying process. That's what that is. It's death. So the person dies within a medical setting. So as soon as they die, those organs are procured and then oftentimes perfused and then transplanted into the recipient. When it comes to tissue, another organization handles tissue, and it usually happens for the most part in this country through the OPOs. And you've got a much longer time frame on that. Tissue can actually be stored. And it's not only tissue, but it's tendon and bone that's part of that as well, as part of the donation process. So, yeah.
I'm confused on those last two examples that you used, the two that you held up.
Yes.
They did not die in a medical center, did they?
Yes, they did.
Oh, I thought you said one of them got into a fight on the
He got into a fight, he went back, hit his head, and was in a coma. And he was transported to VCU Medical Center, where the doctors there realized that there was nothing that they could do, that he was brain dead, and that was irreversible. And so both of those cases, one was the Delaney's, their son Luke was taken to VCU Medical Center, and that is where it always has to happen, is in a medical setting. It has to be within a hospital or some type of hospital setting that would allow the body to stay, that they keep them on a ventilation system until the procurement can happen. Yes?
So you're saying you could have an automobile accident, and if you died later in the hospital.
Exactly.
that would
But you
still
didn't
be-
die at the scene, you died at the
You
hospital.
died at the hospital.
That's
That would
exactly
still be
right.
considered
Right.
accident.
So a lot of our donations come through stroke victims. A lot of our donation comes through car accidents, just traumatic injuries that they make it to the hospital, but once there, doctors, that we just are not going to be able to save them, and that they know that their death is imminent. Yes?
A couple
Right.
things. One on this, if you said the family member has to okay that there, there's not always a family member available. Is an advanced medical directive if the patient...
And so here's the thing when it comes to donation. That's the reason this is so important to have, because time is of the essence. And I think you get that by hearing how quickly everything can transpire. So here in the Commonwealth, as of 3 years ago, State law says that if you are registered as an organ donor, that means you have the heart on your driver's license, that's a binding contract with the state. And that means that if something happens to you, if and when that time comes, and the doctors are, you've got you in a medical setting, and they're like, oh my gosh, we cannot save Lisa Schaffner. Oh, they check records, Lisa is registered as an organ donor. They will come to my 2 children, they will say, we're so sorry, we have done everything that we possibly can, but your mother's not going to make it. She is registered as an organ donor here in the Commonwealth, and this is how the process is going to work. They will walk you through it. They're my wishes, and the state will make sure that my wishes are adhered to and that I am an organ donor. Up until 3 years ago, what would happen, and sometimes infrequently did, because death is so unexpected, you go to my kids and they're like, no, you can't, we don't want mom, we don't want that. And because the doctors did not want to upset family members, they would back away and say, but these are the wishes of your mother. No, we don't care what she wanted, this is what we want. And so state law changed 3 years ago. That's the reason it's so important that you talk to family members. If you haven't had that conversation and you do not have a heart on your driver's license, or there is no record of your wishes, then that's when doctors will come to your family members and say, hey, we've tried everything we can to save your loved one in this medical setting. It's not going to happen. They are going to die. Would you consider them being an organ donor? And that's how that process comes. It's great to have it in your medical directives, but let's be honest. If someone's horribly injured after a car accident, the last thing you're thinking about is going to the will or the medical directive going, oh, what's mom and dad think about this? You're in the moment at the hospital trying to save their life. So that's the reason we really encourage people, A, to sign up through donatelifevirginia.org, your DMV, or have that discussion with your loved ones so that they know how you feel about it. And I think you had another question in the back?
No, I think it's been answered.
Is that good? So let me just make sure everybody understands. There are 2 ways in this state and all across the country. There's not a national registry. UNOS just doesn't go and say, we've got all of these OPOs and these state registries that are connected to our computer system. So here in Virginia, it's done through the DMV. So you go into the DMV, again, by state law, they are required to ask you, would you like to be an organ donor? And that's how that heart gets on your driver's license. And if they don't ask you, they should. Call it to their attention, because they're supposed to, right? And you can do it at the DMV, or you can go online and do it at donatelifevirginia.org. And it's the same website that the DMV has that you can do it yourself. And you just sign up to be an organ donor.
I just thought of another one, yes. You said that there was no age limit as a recipient. Is there an age limit as a donor?
No, there is not. And in fact, and again, we don't set an age limit, but there are age limits that are sometimes and often set at some of the transplant centers, in that they feel uncomfortable doing it beyond a certain time frame or age date. And a prime example of that, I've talked to some of the surgeons that 10 years ago, they didn't really like doing heart transplants past the age of, say, 50 or 55. They just didn't think that the patients lived much beyond that. Well, now they're finding huge success. There are people that have heart transplants at 60, 62. And that's when it gets a little, some transplants centers will do them higher age and some won't. And it just really depends on that transplant center. And a lot of that information is on our website as well.